The GP essentially said, "You're producing no sperm, so you won't be able to have children. Take it to get out the door, away you go. No support whatsoever."
The problem is growing. Men in the Western world are becoming less fertile.
The population don't understand just how common it is. Over the last 50 years or so, sperm quality has decreased.
For the first time ever, problems with male fertility are the primary reason for couples seeking IVF, but it's rarely spoken of.
He didn't feel like a man, and that's so unfair.
A lack of research means men aren't being offered the best treatments available.
Men are not being looked after properly, not diagnosed and not cared for.
I don't think we were at any point offered an alternative to IVF on the NHS.
And men aren't being told the consequences of poor sperm quality.
Men who are over 45 are more likely to have children who will have childhood cancers.
So, what needs to change?
Well, we got married in 2010 and decided a year after that we were going to start trying for children.
And it just didn't happen. I said to Craig, we need to get tested.
When Craig and Katie Franklin from Clacton had difficulty conceiving, doctors presumed the issue must lie with Katie.
I definitely think the GP and the gynaecologist definitely thought it was to do with me. And then I had the procedures that obviously told us that it wasn't.
Only then, after invasive testing on Katie, was Craig's fertility considered. Like many men with fertility problems, when the results found Craig had no sperm due to a chromosome defect, the news was not sugar-coated.
The very blunt answer we got from the doctor was, "I'm sorry, you won't be able to have children." That was literally it. We're off out the door, bye-bye.
There was no compassion, no nothing there. That just absolutely destroyed us, completely destroyed us.
Do you think he would have been as blunt if it was a problem with you, Katie?
I don't think he would have been so blunt. I think it's very common for a woman to have issues with fertility. And I think they deal with that quite regularly, whereas a male fertility side of it they don't deal with at all.
Male infertility is now the most common cause of couples seeking IVF in the UK. And it's a growing issue, with men wanting to have children later in life and sperm quality decreasing due to modern lifestyle factors such as processed food, alcohol consumption and being overweight. Alison Campbell is Director of Embryology at the UK's biggest chain of private fertility clinics.
1 in 6 couples experience some form of subfertility or infertility, and about half of the cases are associated with male factor infertility. And it's not just as simple as how many sperm are present in the semen sample, it's the quality of those sperm. It does appear, and the literature would support, that over the last 50 years or so, sperm quality has decreased. Sometimes we have more eggs than we have sperm. It doesn't happen very often, but it's a huge challenge.
Professor Sheena Lewis is one of the UK's leading fertility experts. She is head of the British Andrology Society, which aims to improve care for men's reproductive health. She believes couples will continue to be failed unless the medical community places much greater emphasis on male infertility.
It's now quite urgent that we look at the problem. Men are not being looked after properly, not diagnosed and not cared for.
One of her biggest concerns is that there's so little research into treatments that IVF, a process that revolves around a woman, is being used to treat male infertility.
Even though the woman may be perfectly fertile, have no detectable problems, the woman actually acts as the therapy for the man's problem. So we are giving an invasive procedure to a person who doesn't need it in order to treat another person. Now that doesn't happen in any other branch of medicine. It's really rather absurd that it still happens.
And each round of IVF is thousands of pounds.
This is a huge expense for the NHS as well as for the couples.
This couple, who asked to remain anonymous, decided to seek out alternatives to IVF for themselves. If they hadn't, they may never have had their son.
I don't think we were at any point offered an alternative to IVF on the NHS. It was basically, IVF is the only way you're going to be able to have kids, so this is the process.
They had been trying for over a year, when they were offered their first round of IVF, despite there being nothing wrong with the woman's fertility. It was unsuccessful and a difficult process to go through.
IVF was not one of the highlights of my life. It was really unpleasant. Injecting your stomach with needles that don't go in the first time is not a walk in the park. Even before the IVF, I had a really invasive test where I was injected with dye. There was a student there and they got it wrong. It was horrible.
The couple decided to see if any other options were available. A private clinic discovered Daniel, not his real name, had varicocele, an abnormality in the scrotum that affects up to 40% of men with fertility problems. But treatment for it is not available on the NHS.
The doctor just said it's not something we do on the NHS. He didn't really know a huge amount about it.
The couple paid for the operation privately, and a few months later, their son was conceived naturally.
For us, it was a miracle when our son came along.
It had been really difficult when the IVF didn't work.
The health watchdog NICE pointed us towards its guidelines, which say varicocele repair treatment should not be offered to men as it has not been proven to improve pregnancy rates. But Professor Lewis says that while varicocele repair treatment won't be the solution for every man, there is real need for the NHS to offer other treatments before IVF.
We would suggest that men see a urologist and have a clinical history, a clinical examination, and some simple treatments before they go to the stage of having IVF.
She believes men must also be made aware of how their own health choices can have grave consequences for the well-being of their offspring.
Men do have a biological clock. It's not the way women have a menopause at 40, 45 and they don't have any more eggs. But what happens with men is, as time goes on, because of their lifestyle, because of their environment, there are more and more opportunities for mutations to occur within their sperm. Men who are over 45, when they have children, are more likely to have children who will have childhood cancers or may have psychiatric disorders such as bipolar disease or autism. And we also know that smoking can cause the same problems in offspring.
But it's not just men who need to be educated. In some cases, it's doctors too. There's so little focus on male infertility. When Craig discovered he was infertile, he was sent by his GP to a women's health specialist.
I was actually referred to the gynecology ward in the women's health side of the hospital.
He was sat with women of like pregnancy, and for us, but just been told that we can't have children, to be sat in that environment was really, really, really hard. And there was actually no men in there that I can remember. It could have been dealt with so much differently.
And it's not an unusual story.
We pretty much got told you either need to adopt or you need to have donor sperm. And they were the only two things that got offered to us.
Mark Harper was told he was infertile, having had testicular cancer.
I don't think they actually had an awful lot of guidance to give you or an awful lot of knowledge. They were clearly following a very set pattern and trying to lead you down certain routes.
He lives in Untitled, Derbyshire, with his wife Suzanne and their 2 children conceived through donor sperm. When Mark was found to be infertile, it was Suzanne that was first informed, leaving Mark feeling sidelined.
As soon as you had the sperm count, I got a phone call at work that afternoon that just said, "I'm really sorry to tell you that the sperm count is 0. We'll make you a referral, make you another appointment to come back in and discuss it." That was it. It was just a phone call, to which I then rang Mark, told him over the phone again, and then came home and obviously were devastated.
Well, the grounds that my wife found out that I didn't have any sperm before I did, yes, that was a little bit surprising. If you're talking to a male about his infertility problems, you ought to be talking to the male about it. But I'm here, I'm a person, I was the one sat in front of you, and I'm the one you sort of need to be talking to about the male fertility issues.
Suzanne had fertility problems herself, but the couple believe as a woman, support for her was much greater.
I mean, certainly from what I've seen, the female is dealt with quite well. But there almost seems to be a lot more guidance, a lot more signposts that the GPs are aware of that can point you that can point you the ladies down the road.
The Royal College of GPs says doctors are highly trained to have sensitive, non-judgmental conversations with all patients and to advise them of the best options going forwards. Craig struggled with the emotional toll of hearing of his infertility.
When we found out about it, I was very angry for a long time. I went mad with money, didn't I? My performance at work deteriorated quite significantly, to the point that I lost my job late last year.
It basically broke my heart, completely broke my heart, and even just talking about it now is making me want to cry. I saw a man break, basically. He didn't feel like a man, and that's so unfair.
This is the first time Craig has spoken openly about his infertility.
Talking about male fertility, I think there was a stigma there. It's not a manly thing to discuss. It's boxed up, put to the back of the mind and sort of forgotten about.
Did you tell any of your friends about it?
No. Me doing this interview today is actually going to say to them, hey, this is my problem.
This is what's happened, yeah.
Thankfully, Craig and Katie are now looking to the future, but they know it could have been very different.
We're still here, we're still together, we're stronger than ever. Other couples might not be as strong as us, they might not be able to work through that. And I can see why they wouldn't be able to work through that, because it's so hard for the man to actually come to terms with not being able to give his wife a child.
They are now looking for donor sperm and are going private, having been refused IVF on the NHS.
I don't think anybody would be really happy with having to use another man's sperm to, procreate.
Yeah.
I think any man would be a lot happy to use their own sperm, but that child would be loved either way, regardless of whether it had been conceived naturally or whether it had been conceived via a donor.
Mark says donor sperm was always the right choice for him and Suzanne. But whatever direction couples take, he says, the key for men is not to be afraid to talk.
Don't bottle it up. If you think you're struggling to have children and you've got an inclination that there might be a problem there, it's time to be open and frank about it, rather than don't bury it, don't go and hide from it. Go and head at it full steam and see if you can find some answers, some solutions, or at least help understand where you're at.